I wanted to tell you a little bit about what happened to me last week and a little bit of history on it and help you understand a little bit more about what's possible for you. So going back all the way to 2006, it was the first time I ever had a low back injury, a low back incident. I had had issues in my lower back because I was a long distance runner. Was doing triathlons, Olympic and half Ironman distance triathlons. And part of the risk of doing, repetitive trauma type of activities is, say, let's say if you're running or you're doing different things that's putting a lot of force in through the lower back, you can start to cause micro injuries in the lower back. And so for me, on the right side of my body here, in the base of my spine, I sprained the ligaments along here. It's called the sacroiliac joint. And so last Thursday, I was getting up from doing something, and I felt a little bit of a tweakiness in my lower back. It's typically going to be off to one side as opposed to directly in the center. And so I recognized that there was something that happened, and I went to go to speak to the other chiropractor in the office, who's also my wife, and I said, can you check it, see what's going on here? And she checked me, and invariably my pelvis had become twisted, and so this can happen where the body becomes, instead of the pelvis being level, it starts to get uneven in one way or the other. So what happened was my pain escalated a little bit on I believe it was on Friday, and I actually got a chiropractic adjustment 4 times on Friday, twice on Saturday, and once on Sunday. So, part of the reason for doing this video is that sometimes when you have a problem, there's multiple things that you can do. But if your hips are not level, if they're in some way cockeyed and there's pressure on one side or the other, it's starting to put pressure at the base of the spine, it can feel like it's spreading, like it's not just in one area, but that it's spread out over a wider area. So, the problem got progressively better over the course of the weekend, but it started at about noon on Friday, and I got checked at noon, and then I got checked at 2 o'clock, and then I got checked at 5, and then I got checked at 8. And then the next day when I got up, I got checked again at about noon, and then again about 5 o'clock in the afternoon. And then yesterday, which was Sunday, I got checked kind of in the mid-afternoon, like 3 o'clock. So, I think that part of what people don't really understand is that chiropractic, first of all, nothing that you do is going to you're going to do one thing and the problem's going to be gone. You need to sometimes have some repetition. But certainly, sometimes people will come to the chiropractor, but they'll come say every other day or once a week or every 2 weeks. Well, there's also benefit in actually doubling up and tripling up in a particular day or week so that you actually are being seen 1, 2, 3, 4 times in a single day. You may say, well, does it mean that it's not working? It doesn't really mean that it's not working. What's happening is we're resetting the positioning of the pelvis to get the pelvis level so that the body can, it's almost like you're retraining or reteaching the body what straight is again. And I've had this problem now for 25 years or so I'm really familiar with it in my own body. But if it hasn't happened to you in your own body, you may not be aware that this is exactly what's happening. Now, for myself, I can feel when there's weakness in the lower back or when things are about to shift, and it hasn't happened. The last time this happened was probably 4 years ago. And so it's been a while since it's happened. But the main reason for this video is that is that sometimes if you do something, let's say you go and get a massage and the massage makes you feel better, there's benefit in going back the next day and having another one, or in a couple days and having another one, not waiting another week or another month to have it done, because sometimes you just kind of keep clearing the inflammation and the interference out of the situation so that the body can feel. So I think that that's about the extent of what I want to explain here. It's mainly that from a chiropractic standpoint, that there's tremendous benefit in getting your spine checked and adjusted, 1 time, 2 times, 3 times, 4 times in a single day. And you may not hear that anywhere else, but that has been my experience, and I just wanted to share that with you. Hope you have a wonderful day. Thanks so much for watching.